Good day everyone! Today I am going to perform on how to assess the prenatal checkup. Prenatal checkup is necessary since it avoids the complications during birth and also it allays the anxiety or any complications during pregnancy. Hi ma'am, good afternoon. So sit down na ma'am ha. Then are you okay ma'am? Okay, so ibutang lang ng imong paper sa ma'am. Before proceeding to the procedure, now you are going to introduce yourself and verify the client's identity and also assess the client's medical history. The rationale for this is that introducing yourself will report and also it allays the client's anxiety, and then verifying the client's identity will ensure that you're addressing the right information or the right procedure to the right client. Mom, good afternoon. Hi, I am Candice Salina. I am a student nurse for today. Ma'am, by the way, so I have some few questions regarding your personal information like sa imong name, sa imong birthday, sa imong address, and then also your contact number, if ever also kung naka-insurance sa PhilHealth or wala. So, okay sa imo ha, ma'am? Okay. What is your name, ma'am? Or kinsa imong ngalan gali, ma'am?
Ranlin Joy, Kuya.
Okay. How old are you?
41.
41. Then, complete address po.
Rockdos, Barangay Colosio, Circle City.
Then, contact number.
093-407-1097.
Okay, thank you, ma'am. By the way, naka-PhilHealth, ma'am, or wala? Ana, Then, ikaw pila nagali ni mo na ang baby, ma'am?
Ika.
Okay. So, ma'am, na ba imong gidala or you have your prenatal card katong always nimo ginadala nga piece of paper something kapag mag-visit ka sa healthcare center. So, naka-ato ka rin, ma'am. Okay, thank you, ma'am. Now, by assessing the client's medical history, so you are going to evaluate if the client has a past medical condition or any underlying birth defects or in the past conditions during the obstetrical history, the geographical history, or any history of the client in the past checkup. Then after that, you are going to assess the client's knowledge based on the nutritional guidelines of the good nutrition and also during the antenatal care. The rationale for this is that you are going to ensure if the client already practices the good lifestyle, especially during pregnancy, and also it's very essential to avoid any complications during labor and birth. Now, ma'am, na ako'y mock question something if ever kung are you already aware on what are the good nutrition or like kabalo ba kaon sa mga pagkaon na dapat during pregnancy, ma'am? So, can you suggest or gina-practice mo na nimo siya katong in the past few days or katong past nimo nga pagbuntis? So, maka-elaborate ka mo or maka-story ka kung unsa to sila?
Buwan ra, magbulay ra ako, tapos bukas. Tapos
Okay.
vitamins.
Okay. When it comes to vitamins also, what are those vitamins, ma'am? So, maka-remember pa ka kung unsa to siya, kung folate, kung iron, or unsa to siya nga food supplement?
Folic acid sa iron na nervapil.
Okay. So, unsa ni siya, ma'am? Like, resita sa imuha or like something ikaw lang sa imong kaugalingon nga ay gusto na ko ni siya mabalit or unsa ba like gina-address or gina-administer sa imuha ng physician or imuhang OB or unsa? Sa midwife?
Midwife.
Okay. Thank you, ma'am. Then, when it comes to exercise, like exercise baka ma'am na kay mga regular regime, like for instance, walking or like even mga activities na imong ginabot sa imong daily living. So, nabaka ka na, ma'am?
Kada padadlaw.
Okay. So, ma-initiate mo ito ma'am kung saan sila?
Ano na ko ako sa walking, di ba?
Walking. So, maka-estimate ka ma'am kung like approximately how many hours? Like for instance, mga 1 hour or like 3 hours each day or like mga 3 times a week, ingana or like everyday with ka
Every day
ganyan.
ko sa mga 3 hours siguro.
Okay. It's a good practice, ma'am. So, katong mga previous nimo ng mga pregnancy, ma'am, wala kay mga birth complication or like dili kasi cesarean, like tanan lang ka normal. Okay. Then after that, you are going to perform hand washing. Hand washing is very necessary in importance to the spread of microorganism or to avoid the spread of microorganism. Now I have with my gloves, and then it deters the spread of microorganism, and also it prevents the contraction of the bodily fluids to the nurse's area. And then you are going to prepare the necessary equipment for this procedure. We are going to use the stethoscope, this one, and then we also have the temperature for the vital signs, and then we also have the hand sanitizer. We also have the sphygmomanometer, and then the tape measure. By the way, Doppler is also essential for this procedure since it will use as an equipment rather to have the fetal heart tone or to hear the fetal heart tone correctly. But since Doppler is not available for me, now I am going to use the bell of the stethoscope for the fetal heart tone. Now let's proceed to identify, and also you are going to explain the procedure to the client. By identifying the patient, you are going to assess if you are correcting or you are assessing the right patient, and then with explanation, it will elicit the client's insight, and also it will build cooperation while performing the said procedure. So, ma'am, by the way, mag-verify na po sa imong name, ma'am, ha? So, ma'am, kanang ikaw to, ma'am, ha? Si Joy, si Kuya, ma'am. Okay, thank you, ma'am. And then, mag-explain ako, ma'am, if on-site prenatal or what are the, what procedures comprises this assessment. So, kanina ay ma'am, prenatal check-up, of course, kabalo naman ka if what are the advantages, especially for pregnant women. So, sa imo ka, ma'am, sa imo ang always mag-visit, kabalo ka on sa mga advantages or like on sa importance on why kailangan mo mag-prenatal. So, do you have any idea, ma'am?
Okay nang lang, kay kung dili ko mag-prenatal pag mga anak na ka, maabot ka sa karaga, sa hospital, hanapan mo ko ng kuno ni mga buwang ko, pwede laboratory ka, o kuha nga ng CBC, tapos ultrasound.
So, more siya, ma'am. Okay, thank you, ma'am, for your response. Then, for additional information, this prenatal checkup will comprises the checking for the fundal height. Now, your fundal height will determine if you're gaining weight. So, necessary siya, ma'am, since mag-determine nato if nag-gain ka or nag-lose ka weight. So, if nag-lose ka weight, of course, dili healthy ang imong baby since nag-grow siya inconsistently. Unlike if nag-gain ka weight, of course, you have any nutritious foods, and also you are have a good health well-being. So, let's proceed to the other procedure. We have the Dupont maneuver. The Dupont maneuver comprises of 4 maneuvers. We have for the first maneuver, we have the fundal grip. So, sa fundal grip, ma'am, it can determine the fetal presentation, especially kung unsang part ang sa taas because sa imong fundus teres laterals. So, ma-determine na to siya aa. Then, we also have the second maneuver or the second maneuver, the umbilical grip. This umbilical grip will enable to determine if what are the sizes or like what part or which sides naglay ang back ng fetus, kung asang part ang iyahang buttocks or like ang iyahang bridge, ang iyang head, and also ang iyang extremities. For third maneuver, we have the Pollux grip. So when you say Pollux grip, it also used to determine the if your fetus is engaging. So when you say engaging, like nana siya, ma'am, sa imuhang something sa uterine segment or like sa imuhang symphysis pubis area bitaw mga part, like nana siya makita na, like for example pwede na siya ka cm or like how many days na mga anak na kainan na kung sa pakalayon. Then lastly, you also have the fourth maneuver. So this fourth maneuver or the pelvic grip, like for verifying na siya, ma'am, for confirmation if sakto ba itong imuhang third maneuver, kung naana ba siya or like wala pag hapon nag-engage ang fetus. So mamot siya, ma'am, sa Lipol's maneuver. In short, it determines the fetal presentation, position, fetal attitude, the fetal heart tone, and also the fetal heart rate. Then let's proceed to the pregnancy exercises. So for the pregnancy exercises, as what I have said a while ago, important din siya kaayo, mom, since it builds the muscle strength, and also it aids good posture to your health, and also it will allays your any complications, especially sa imuhang body, ma'am. So kanang sa imuha, ma'am, mag-ask ko again if unsa galitan mga activities na imuhang ginaingat kanina.
Mag-walking ra ba din?
Mag-walking na siya, no? So, wala kay something, mga regimen, like for example, mag-meditate ka or like something is like mag-kuan ka, mag-exercise, like for example, it's like the mga workout, like for example, mag-tailor sitting or like mag-pelvic tripping or like unsa nga mga exercises mo. So, walking na dito imo ha, ma'am.
Walking ra sa daw naman ako sa
Okay. So, gauma po dahil mo, ma'am. Okay. So, it means dagat pag mo mga gulay ba? So, that is why nakatuntod ka ganina, nakakaon ka og mga nutritious foods. Okay, ma'am. Thank you, ma'am. Let's proceed to the taking of the vital signs. Now, vital signs, as we all know in our fundamentals of nursing, it comprises of the checking the blood pressure, the pulse rate, the temperature, and also the respiratory rate. It will also serve as the baseline for the assessment and also for future purposes, especially if the client has a complication in the past medical history, and also to the future history of the client. Now, ma'am, mag-measure guide ko sa imuhang blood pressure. So, first is ang video ni mo, ma'am. So, pwede ana lang imuhang isa ka pa. Relax lang ta, ma'am, ha? Then, ana lang ka. Sige, ma'am. Relax lang ta, ma'am, ha? Chill lang. Wala ra katagul ba, ma'am?
Yes.
Pero dili pag ka something anemic atong previously mo nga pag-visit sa health center.
Dili sir.
So 115 over 90 siya, ma'am. Then after that is the measuring of the temperature. So ma'am, kani temperature if ever basi kahit tanan ka or if normal lang imo ang temperature. So kaning digital ako ang gigamit, ma'am, since wala ko katong isang tao nga ikuan lang sa imo ang head report. Sige, ma'am, direct data, ma'am. Ana. Then while checking the temperature, you are going to check also for the pulse rate with the use of this stethoscope. So you are going to assess that for 1 full minute. So the client temperature is 36.7 degrees Celsius, and also for the pulse rate, we have 110 beats per minute. Then lastly, we have the respiratory rate. Then again, with the use of the diaphragm of the stethoscope. So ma'am, ana lang ta, ma'am, ha? Then ako alam something kung ana ko nga ma'am, inhale, then mo-inhale, then exhale, exhale ko lang. So, inhale, ma'am, exhale. Inhale, exhale. Inhale, exhale. Inhale. So the client's respiratory rate is 18 beats per minute. Then after that, you are going to document those kind of assessment or the vital signs which you are taken. Then mom, after that, I will measure your weight and also your height in order to have the baseline for the maternal complications, also for the maternal outcome. So this is why very important siya, ma'am, ngayon pinato pang check. So after ta, ma'am, kanang diri ata mag-take ta sa imo, ha. Okay, ma'am, sit down. And then after that, sa imuhang height, ma'am, so diri ata, ma'am, something sa kilid. Like, imagine that imagine that I measure your height, ma'am. So, something, ano lang ka, ma'am, sa ilid. Ano. Then, ako i-anas. Okay, ma'am, thank you. So, sit down at the balik, ma'am. Now, mom, since I am done with your taking of vital signs and also for the for the pre-assessment. Now, let's have the measuring of the fundal height and also the Lipons maneuver. So, is it okay for you, ma'am, to transfer to the assessment room? So, okay, ma'am? O, sige, ma'am. So, let's proceed now to the performance of the fundal height, the measurement of the fundal height, and also for the Leopold's maneuver. Now, since we don't have an assessment room or there is no bed, then we are in the lying position and then on this side, and then I am going to have the patient on this part. So, ma'am, pwede na ito proceed before anything else, ma'am, I asked a question, plus 30 minutes ago ka nang nangihi ba ka, ma'am, or wala? Okay. So, approximately mga 30 minutes ago to siya. So, as of now, wala pa pagkaliihi. Okay. So, this is very essential, mom, since if your bladder is full, if this her measures imong fundal height rather, then it signifies that your bladder is full and then it is from 30 cm for the 17 to 20 weeks of the gestational age. So that is why it is very essential that I asked if you urinate in the few minutes ago or let us say karon kaihon ka. So dapat dili full imong bladder while performing the fundal height or the Leopold's maneuver para ma-check na to correctly ang imong fetal position and also sa fundal height nimo. So okay na ta, ma'am? Sige, ma'am. Proceed na ta, ma'am, Dorita. So the first thing that you will need to do is to have the client in a supine position. So higda lang ta, ma'am. Then with the clients both feet slightly flex. So slightly siya pag-flex, ma'am, ana. And then after that, you are going to place a blanket to the unexposed area of the client, and then this pillow will be placed at the top of the client's head. So, wait a moment. So, placing the pillow and also the blanket will ensure that the client maintains her dignity and also for the client's privacy. That is why it's very essential to perform this kind of procedure. So, this is now after this one, you are going to ask privacy or ask concern for the client for exposing the abdomen part. So, ma'am, I am going to expose your abdomen part, this one, so that I can measure the fundal height correctly and also your Leopold's maneuver. So, is it okay for you, ma'am? Okay, ma'am, thank you. So this time, you are going to measure from the fundal height. As what I have said, ma'am, ang fundal height, I will determine or will determine if the upper part of the uterus or the fundus will be the fetus head or the buttocks of the fetus. So, ma-determine na today siya, ma'am, and also if ang imong fetus is na-broken siya consistently or inconsistently. Now, I will make use a tape measure, and this one will be use the measurement for centimeter, not the inches. Since centimeter will have the correction or the correct measurement for the procedure instead of inches. So this one we have the centimeter. The centimeter will be placed at the symphysis pubis or the pubic bone of the patient. So for the uterine segment or the lower part. And then you are going to fold this one at 0. Then place this one at the top of the symphysis pubis. Then after that, you are going to place the tape measure at the top of the uterus. So you are going to palpate gently and slightly if this is the top of the uterus. So the fundal height is 28 centimeter. Then after that, let's proceed to the performance of the Leopold's maneuver. Mom, after this one, or after sa katong proceeding procedure, so i-perform na ko ang Leopold's maneuver. This Leopold's maneuver will determine your fetal presentation if it's encephalic. When you say cephalic, kanang nag-unang iyang ulo. When you say bro or like breech, like nag-una ang iyang ilma part or what we call in vernacular in Bisaya, nga kanang suhi bitaw siya. So this is the, siya ang two common types ng presentation sa fetus. So again, ma'am, ako na po di-expose ang imong abdominal part. So okay, ma'am?
Okay.
Okay, thank you, ma'am. Now for the first maneuver, you are going to place or the fundal grip. By the way, the first maneuver is the fundal grip. Now you are going to place your both hands at the top of the uterus. So in a triangular position, this one, your hands will be like this in order to determine the top part of the uterus if it is a cephalic or the breech. Now you are going to palpate lightly. With the use of your hands instead of your fingers. So since it is softened or softer, now this part is the breech or the buttocks of the fetus. So it is softened since the buttocks will remove conjunctivity to the body while the infant is moving. Then after that, we have the second maneuver or the umbilical grip. For the umbilical grip, you are going to place your both hands, this one, to both sides. So for the one side, for the dominant side of the patient and also for the non-dominant side of the patient. So you are going to place these both hands in this part and then you are going to palpate in a downward direction. So palpate lightly in a downward direction. Then after that, you are going to have your non-dominant hand in the symphysis pubis and then in the static motion. So it is in static motion in order to determine if the extremities can be found in this part. Then this part will be moving or exploring if the buttocks can be found or there are loosened mga structures or like mga smaller parts that you are founded or like ma-feel nimo while palpating the said part of the abdomen. So at this part, since it is softened and also I can feel a smooth or this one is called as the back part of the fetus. And then for the other one, I can feel the most often, so it is the lower extremities. And then after that, you are going to determine the third maneuver. For the third maneuver, or what we call as the Pollitt's grip. For the Pollitt's grip, with the use of your right hand or this hand, you are going to have this in a C position. This C position will determine or will be placed at the lower part of the uterine segment or the symphysis pubis bone. So with your fingers and also your thumb, you are going to have this one in order to feel if what are you going to feel in this segment. So I can feel that the head is firm and also it is also known as the cephalic head. Since it is firm and don't have any motion or like wala siya mga other surfaces or like humok unlike sa bridge or sa buttocks mo part. So this is the head and the attitude is engaging since it is not floating or like the head of the fetus while having the inlet part of the mother's symphysis pubis. Then the last maneuver is the pelvic grip. For the pelvic grip, we are going to determine or like we are going to verify or just like confirmation for the third maneuver or like if your fetus is in a live position or it was just like the position of the fetus is in the cephalic or like breech. So you are going to confirm now. So with the use of your both hands, then you are going to place or palpate downward and inward to both sides. So with the use of your fingers, not your palms. So in downward direction, Then after that, you are going to have that in an inward position. So, for differentiation, now the infant or like the fetus rather is engaging, just like what I have gathered the data from the third maneuver. Okay, thank you, ma'am. So after that, you are going to have the privacy and also you are going to have the patient in a comfortable position since you are done with the Leopold's maneuver. So ma'am, since you are done with the Leopold's maneuver, okay ka ma'am or I na-feel na something wrong with your body or like your abdomen?
Okay lang.
Okay siya ma'am. Okay, then after that, you are going to have the patient in a sitting position since you are done with the Leopold's maneuver and then proceed to the next procedure. Then after that, ask for the privacy of the patient. So, ay ma'am, kanang pwede relax lang ta or like ang imong head, react, murag something, wala na ka na maana lang siya. Then after that, you are going to assess again for the fetal heart tone. So, ma'am, kanang expose po na ko siya ma'am ha, ka-illocate na ang fetal heart tone. So, this fetal heart tone will determine if how many beats per minute your fetus will be beating. So, for the normal heartbeat, we have 120 to 120 to 160 beats per minute, but for the average is 140 beats per minute only. With the use of the stethoscope, so you are going to auscultate the fetal heart tone by locating again the back part of the fetus. Since as what I have done with the previous assessment, so the back part of the fetus will be locating in this side. Then after that, you are going to place the stethoscope or the bell of the stethoscope on the part of the point or where the location the back of the fetus will be located. So you are going to have that in a 1 full minute. So ma'am, just relax ma'am ha, and if ever you have any queries, so just approach me directly. So okay ka ma'am? Sige, thank you. So since it is 1 minute and then the fetal heart tone will have in the 140 beats per minute. So mom, we are then also with the fetal heart tone. So again, let's have in a sitting position for the preceding procedure. Then after that, you are going to document the observation made. So with documentation, you are going to document for the fetal presentation. So for my patient, it is encephalic presentation. Then the fetal attitude is fully flexed. And then for if it is engaging or not, yes, it is engaged. And also for the fetal heart tone, it is 140 beats per minute. So, mom, since I have done checking with the Leopold's maneuver, your fetal heart tone, or the presentation, the fetal attitude of your fetus. So, as of now, let's proceed to the another procedure. So, by the way, mom, if ever na-conscious ka, all of those documents were documented and evaluated for future purposes, especially for your, if ever ka nang mag-labor na ka or like during mag-ato na ka sa hospital, so that ma-verify if okay or like di okay ang imuhang baby or ang condition rather is imuhang baby. So, since we're done with the procedure, so I am going to administer a tetanus toxoid vaccine. So this vaccine, as what I have said a while ago, it is very necessary. So mom, important kayo ang tetanus toxoid in order for your fetus to avoid from any infection from a tetanus, especially sa imuhang well-being food mom since you are pregnant. So that is why mag-administer ko karon ma'am ha. So first, you are going to clean the deltoid area or the left side of the patient with the cotton with an alcohol. Then after that, you are going to have this in a trash can. Then administer now the injection. So you are going to administer a tetanus or the tetanus toxoid vaccine. So, relax lang ma'am ha. Then, important niyo siya kaya para wala yung mga complications or mga tetanus infection sa inyo. Thank you ma'am. Then after that, you are going to place an alcohol, cotton with alcohol on the affected part. So, pwede nyo siya mag-pilitan. Then after that, you are going also to administer or give the iron folate supplement since it aids the development of the fetus and also it promotes the good nutrition and also the proper nutrients for the mother, especially that she is pregnant. So mom, I have here an iron folic acid supplement. So it is very necessary and you will need to take this for 2 months after your postpartum period. So imani siya ma'am i-take once a day or like before ka mo at sa bed or else ka nang before ka mo kaon sa imong breakfast. So kani siya ma'am ha. Then after that, if ever the physician or the doctor will prescribe the malaria injection or the malaria prophylaxis, which contains the hydroquinone or the injection for malaria, you are going to administer that for the client since it reduces the risk of transmission of infection, especially for the mosquitoes. Since the as of now, our community always gaulan, so dagan yun na siya labo. And then, after that, you are going to have the client in a comfortable position. So, ma'am, can I relax na the ma'am ha again? And then, you are going to teach or educate the client regarding the good nutrition during pregnancy and also the personal proper hygiene. So, ma'am, mag-discuss pa rin regarding sa what are you going to do, especially during your pregnant. So, since di pa man kakaayo kapit mga anak ma'am. So, these things or these precautionary measures will help your infant also for your well-being healthy. So, ma'am, the first thing is that what are the nutritious foods that you are going to eat? So, unsa mga masustansya na pagkain mo gusto kaunon or like needed mo na i-eat. So, these are the variety of foods. The foods that contains or that encloses to the 3 food groups. We have the go, grow, and glow. So, we have the veggies, the fruits, the chicken, mga fish, then also, sometimes pwede ka touch sa red meat but like mga twice a month lang siya since makakause na siya ng high cholesterol and also high blood. So, for the water, you will need to consume mga 10 to 12 taps every day since water is very essential for us. It will also boost our digestion, especially for our gastrointestinal tract and also for food healthy and imuhang status. Then, kanang kuan po siya ma'am, kanang sa imong exercise gali, kanang pwede po, kanang aside sa kanang mag-walking ka, like na ko'y i-teach later about sa mga pregnant women exercises or mga common na siya ma'am, then it ay siguro portion also the wealth or well-being of your infant at also sa imong hapon. Then lastly, sa personal hygiene. So for personal hygiene, mom, the first thing that you will need to do is to, of course, take a bath daily. And then, of course, kana mag-brush ka 3 times a day sa teeth. And then, since pregnancy or pregnant women are most common for some infections, especially for the sa mga private parts or sa pubic area. So that is why it is necessary to use kanang mga mild soap, not kanang mga beautifying soap na na mga chemicals dito siya, ma'am. Like for example, kanang mga Kojic or like mga other nga pampagwapo dito, mga sabon nga dagan kay chemicals. So bawal na siya para sa inyo ha. And then also, need po ni mo ma'am nga kanang magwan gali ka kanang for example, sa imong personal hygiene kung maligo ka then mag-comb din hair. So imo na pag-comb din hair regularly. So more na siya ma'am regarding sa kanang sa good nutrition and also sa personal hygiene. So nakakuha ka ato ma'am? Okay, so thank you, ma'am. Now today, we're going to assess the pregnancy exercises. So I have my patient, ma'am. So karon magkuha na ta, ma'am, sa pregnancy exercises. So ang first nato na buhaton is ang good posture. Good posture is very necessary. So sundok lang ka sa ako, ma'am, ha. So ang good posture, anak ka. And then, ang imong chin is forward o ana. Then, dili ka pwede mo yuko. Kaya para dili bitaw makaling mo ang mga bone muscles. Sige, ma'am. Then, ang pinakauna nato, before to proceed sa pregnancy exercises, so, mag-warm up sa ta. So, sige, ma'am, ha. Mag-kuhan ko, mag-demo, then musunod ko ka. Sige. Ang first is ana, ma'am, ana. 1, 2, oh, isabay-sabay. 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then after lang, nasa ma'am, 1, 2, 3, 4, 5, 6, 7, 8, 7, 6, 5, 4, 3, 2, 1. Sabi kasi sa 1, 2, 3, 4, 5, 6, 7, 8, 8, 7, 6, 5, 4, 3, 2, 1. Tapos pagkahuman ma'am, anak na po, 1, tapos anak, 2, o no, tapos balik na po, tapos 3, 1, 2, tapos taas na po ma'am, tapos anak na sa 1, 2, 3, 4, 5, 6, 7, 8. Pabali ma'am, bali. 1, 2, 3, 4, 5, 6, 7, 8. So, tapos na ma'am sa warm-up, then proceed na ta sa exercise. So, ang first exercise is ang standing. So, sa standing is mag-stand lang ka, then imong itakin ang imong diri ang part sa tummy, and then imo lang ikuan, ikalaong sa likod. Anak, kibal itakin yung gamay, then inhale, then hold for 30 seconds, then exhale. Inhale, exhale. Inhale, exhale. Then after na ma'am, is na po sa pelvic rocking. So, sa pelvic rocking is magamit na diri sa floor. Sige, ma'am, ha, mukha na sa ako. So, first is, ang imong knees is ana sa floor, and then, two hands is napit sa floor. So, itakin na gihapon yung sa imong abdominal na part, and then, pag-anak, inhale, exhale. Inhale, exhale. Inhale, exhale. So, lahat na punta, ma'am, sa pelvic tilting. So, ang pelvic tilting, sundog na lang sa ako, ma'am. Anak, igda, then, after that, mulay ka, dayon, ang imong both hands is diri sa kilid. So, diri sa kilid, then, imo dayon ipataas ang diri apart. So, makaya niyo siya, ma'am. Sige. 1, 2, 3, 4, 5, 6. So, sa another na punta, ma'am. So, sa knee chest twist, ang knee chest twist is, ano siya, ma'am? Balik rin hapon siya kakita. So, pwede po mga tanawin sa kunin mo. Ang first is magkigda ka, and then, ang knee is i-bend mo slightly, anak daw, ma'am. And then, ang diri ang apart, diri. So, kung ini siya, ma'am, kay diri so dapat ang imong face, diri pa sa gilid. So, dapat opposite sila. Oo, sige, atra, ma'am. Alata. Sige. 1, then bali na po. 2, 3, 4, 5. Sige, ma'am. Tapos sa lahi na po, we have the leg raising. So, sa leg raising, so, para makuha na to, balik na po tayo sa supine position. So, higda na po na, ma'am. And then, ikuan po na to siya, ang leg raising. So, of course, leg man. So, ato siya ipataas. Like, for ano siya, ma'am? 1, mataas siya ni mo. O, anak. Tapos, 2. Anak. Then, 3. O, sige. Tapos, proceed na po na, ma'am, sa lain. So, important dito siya, ma'am, since ma-stretch po ni mga imong muscles, and also, ma-insert ni ang imong uterine contraction pag mag-labor bitaw, and also during birth. So, that is why very important siya, especially when you are pregnant. So, pag mag-labor ka, di na ka dahil masakit-sakit since nakuha na bitaw mo siya, like, nakapractice na ka mga exercises. Now, let's proceed to the other pregnancy exercise, ma'am. So, we have the Taylor sitting. So, Taylor sitting, so, follow sa ako, ma'am. Then, you will need to sit down. And then, kanang ipaanak bitaw nimo, ma'am, ang imuhang tiil, iana, wait, sakay, hindi siya ma-stretch. Then, iana, mapano nimo siya, like, mabend, ana, so, mabend nimo siya, ana. And then, diri bitaw nimo, ibutang ang imuhang kamot, diri both hands. So, pamwana ko nga, inhale, itakin nimo ang imong stomach part, inhale, exhale. Inhale, exhale, inhale, exhale. So, necessary siya, ma'am, since para makuha ng mga chunk ng mga extremities bitaw, mawala ang mga pain diri ang apart. So, let's proceed to the another exercise. So, ma'am, mag-line ka po ka diri, and then, we have the trunk lifting. So, for trunk lifting, katong i-ana ka, ma'am, sa Taylor sitting, i-ana, one, murag is something straight, turn mo inyo may anak siya, then katong inibitaw, steady ra bitaw imo ulo, like straightforward na siya, dili siya malihok. Like iana dayon. One, then sa ana na po. Two, ana, sige. Tapos i-try daw mo ka ng straightforward, bitaw imo ulo, dili siya mag-bend, para dili bitaw magsakit ang imo ang gray asa neck nga part diyon, no? One, sige, ana ma'am. Two, sige. Then, let's proceed to the another one. We have the shoulder circling. So, for shoulder circling, gagamit kitang chair, ma'am, and then, ang first is, ako asa mo mag-execute. So, first, ang imuhang feet, dapat diri ang nakabutang, then nakalusin ang imuhang duha ka shoulder diri. Then, ana lang, 1, 2, exhale. Pag ana, inhale, exhale. Tapos, balik na po, inhale, exhale, inhale, exhale. So, ikaw daw, ma'am, try. Sige.
Amo sa leg.
Ano ra, ma'am, then nakalusin ang imuhang duha ka hands freely para dili magsakit ang imuhang dili as a trunk part. So, sige daw, ma'am, sa shoulder on draw. Sige, 1, sige, 2. So, pabalik na po, ma'am. 1, 2. Sige, thank you, ma'am. So, lahi na po. We have the knee bending. So for knee bending, it helps to ease the pain in the lower extremities, especially for the knee cramps. So, pag-perform ni ma'am, so ang duha ka feet, like more pinag-vista siya something, and then 2 hands put to the chair, then mo ka ma'am. 1, 2, 1, 2. Inanner siya ma'am. Next, we have the trunk lifting. So for the trunk lifting, again ma'am, so let's sit down, and then sa tinor sitting, we have siya ang inyong position, anak. Then, ibutang ni mo diri ang isa ka hands. Then, straight lang ka forward, chin up. And then, ang kaning nga side, ana. Then, straight lang ang imuhang pa. Dili na may bend imuhang neck part. Sige. So, sabi ka sa mong then try daw ang imong because sa ulo nga part dili siya ma-bend. Dili mo siya tan-aw mura. Ang inner bito ang magdiyo ko, ana. 1. So, ina na siya ma'am. Then, 2. O, ana. And then, so, let's proceed to the shoulder circling. So, for shoulder circling, we are going to use the chair. So, for the chair, so, mag-sit down to the ma'am, and then, after that, ang imong both feet, diri sa ubos, then make sure that your shoulder loosen widely. So, diri siya freely, and then, mag-ano ka, inhale, exhale. Inhale, exhale, then, pabalik na po, inhale, exhale. Sige, ikaw daw, ma'am. Sige. Anak ta, and then, ayaw daw, itin ko mga imuhang feet. Sige, anak siya, then, iwan lang. Sige, inhale, exhale, inhale, exhale. Sige, pabalik na po, ma'am. Inhale, exhale, inhale, exhale. Sige, thank you, ma'am. Another one, we have the knee bending. So, for the knee bending, it is the pain or alleviates the pain in the lower extremities. So, for this one, we are going to have the V position. So, inani siya, and then, your hands will place on the chair. So, you're going to bend your knees slightly. Like, 1, exhale, inhale, exhale. So, inana siya, ma'am. So, inana, then i-place. Sige. Inhale. Okay. Exhale. Then, inhale. Exhale. Thank you, ma'am. And then, let's proceed to the leg liftings or the calf lifting. So, for the calf, let's have to, so, you're going to use also the chair. So, for the chair, like, standing mo freely ang imuhang both feet, and then murag iban mo ang imuhang right or asa nga part kung sa right or kung sa left, then ang imuhang right part or opposite sila. So inano siya ma'am, 1, 2, and then ano na po ka, 1, 2. So sige daw ma'am, ikaw. Sige. 1, oo, sige, ileg ang raise, sige. 1, 2, sige. Oh, straight rather. Another 1, 1, 2. Sige. Then, another side na po, ma'am. Same rin gihapon, very So, sa lahi na po natin yung muna part. So, dito daw ka, ato bang ana. Same rin gihapon ng procedure. Sige. Leg raise, go. 1, 2, sige. Leg raise, 1, 2, bend. Sige, ma'am. 1, 2, sige. Lahi na po. 1, 2. Sige, thank you, ma'am. So, afterwards, this pregnancy exercise is necessary for easy labor pain and also sa imuhang pag-deliver, ma'am, sa imuhang baby. So, katong rin sa shoulder circling or katong ma-promote ng good posture and then sa other na mga exercise. So, let's proceed na sa cool down. So, for cool down, mag-ano po sa ako ang magsundog. So first, sa cool down. So we have ana ma'am. Then 1, then ana inhale, exhale. Inhale, exhale, inhale, exhale. To the other side. Inhale, exhale, inhale, exhale. Then another one sa ma'am. So gamit sa sabta diri So diri then ibutang nato diri 1, 2, 3, 4. Then ana na pud. Then diri 1, 2, 3, 4. To the other side 1, 2, 3, 4. So another one ma'am is balik na pud ta sa katong ang sa shoulder. So let's have go 1, 2, 3, 4. To the back part 1, 2, 3, 4. Then we also have anak ka ma'am, then like mag step then sabay pud sabit 1, 2, 3, 4. 1, 2, 3, 4. So that's all now for the pregnancy exercises. Let's proceed to the breastfeeding. So first, the first thing that you will need to do is, since for the previous assessment, you are introduced already yourself. So now you are going to explain the procedure to the patient. So ma'am, as of now, we are going to assess the breastfeeding. So I will teach you on how to have the proper breastfeeding, ma'am. And then it ensures that you have gained the knowledge and skills while breastfeeding for your infant. So then ensure that the client provides privacy and also comfort. So it is very necessary since it promotes the client and also it allows the client's anxiety. So ma'am, karon before that, mag-do sa hand washing in order to keep the spread of microorganisms sa imong mga hands. Sige ma'am ha. Before teaching the client in how to breastfeed, and you are going to wash or clean the client's breast with the use of the cotton or a cotton ball, and then you are going to soak this one in a clean or itapon clean lang kakaroon sa imuhang kuan ma'am, sa imuhang breast. Oo. So pwede na-expose siya ma'am, then sa other side also niya. So pwede mo ay kanang ano nito siya ma'am. Ay wala pa siya ma'am matapos. Sige. Okay, paano rin ako siya. Then sa other side na po ma'am. Now, position the mother in a comfortable position. Usually, the mother will be sit in a sitting position like this. So, ma'am, kanang okay ra ka? Sige. Then, place the pillow on the mother's lap. So, ma'am, I have the pillow. So, this pillow, like, iana dito ma'am, imuhang lap. Then, diri ana ibutang ang baby. Ana. Ay, ana siya, ma'am. Ay, pwede ikon-kuhan daw. Diri ang mga parts imuhang fit, itas-tas, ana siya. So, by placing the baby on the pillow, on the mother's lap, it is necessary since it will allay the damages of the baby, especially for the head of the baby or other parts of the body. Now, instruct the mother to hold her breast in a U position. So, for the U position, ma'am, pwede ma-expose ang imong breast part. And then, U position sa ma'am. So, dapat, ang imong, kani mga part, o kani. So, dapat, kani imong thumb. So, dito sa outside, o ana. And then, ang imong fingers dito, so, pinaana dito siya ma'am. Pinakap, o ana. So, ana siya ma'am. So, U cupping is necessary for the infant to have a proper breastfeeding and also easy access for the infant when having breastfeeding. So, for the another position, we have, pwede na natin ma'am po ano nasa. We have the C position. So, for the C position, again ma'am, same siya ma'am, pwede rin din pag, ato sa bigas, same rin gihapon nga pa sa other hand. So, C position, kanang like C position na siya ma'am, like, instead na katong ganina sa ubos, so, diri na sa side. So, kaning thumb, diri sa taas nga part, sige daw ma'am, anak. Diya sa taas nga part, and then, ang fingers sa ubos, murag something anak siya, o anak. O anak siya ma'am, anak. Then make sure that the nipple will put on the infant's mouth. Now, instruct the client or the mother to have the baby in a right position by putting her other arm to the back of the fetus, or the baby rather. So, ma'am, kanagi, ano nimo siya, and then, so supporting on the base or the skull of the fetus is necessary to avoid any dangerous or damaging effects. So, ano siya, ma'am, then we're sa pagkubos dito na siya. So, So with this position, it supports the baby's head, the neck, and also for the shoulder to avoid any damages or complications. Now let's proceed to pointing the fingers and thumb towards the baby's ears. So make sure that kani ma'am is naa ang imuhang thumb and fingers nasa may kanina bitaw siya nga part dira kay para bitaw wala mo complication or like mahulog ang ulo since ang baby is sensitive kaayo siya kung bago siya na newborn no. Now instruct the mother to touch the baby's lower lip with her nipple to get the baby's mouth to open. So ma'am kanang ang imuhang nipple is matouch na siya sa lower lip sa baby. And then, after that, you are going to wait. So, mag-wait ka ma'am until nga bitaw mo wide open ang mouth sa baby so that maka-breastfeed siya patayo. Then, bring the baby quickly. So, dapat ang baby ma'am siya ang mukuan sa imong breast or sa imong breastfeed instead na ikaw ang mag-apan sa iya ha. So, dapat ang kuan nimo is nagyud sa iyang sulod sa iyang mouth. So, by tickling your baby's lip, it encourages the opening of the mouth or the wide opening of the infant's mouth to open widely. Then after that, while doing, let the mother guide her breast into the baby's mouth. So after that, ma'am, since ang baby still pa siya kaayo ka newborn ka man, now imuhang i-guide dito ang baby like ang iyahang mouth. So pag-guide nimo is ang baby is mo ana sa imuhang nipple and then ang nipple po is dapat naa siya sa sulod. Then after that, this will help the mother to have good teaching and also promotes the high milk flow and minimizes the nipple discomfort for the mother. Also, the signs of good attachment, we have these 4 signs or the signs when the baby or have a proper engagement for the mother's breast or the proper breastfeeding. So first is let the lower lip of the baby to have on the mother areola instead the upper lip. So dapat siya ma'am nga ang lower lip sa baby is not good sa imong areola, so maka-enclose good siya diri sa imong nipples. And then after that also another one for the good attachment, we have the baby's mouth is widely open. So pag mag-widely open na siya, then makasulsi na siya patayo. And then also we have the baby's chin. So kung ang chin niya is dapat closer din na siya ma'am dira ang part sa imong breast so that makakuha siya milk when having a breastfeeding. So proper engagement is necessary in order to avoid any complications and also to have a proper positioning or like latching or proper engaging while having breastfeeding. So those are the 4 signs. For breaking the latch, you are going to teach the mother to break the baby's latch by putting one finger in the corner of the baby's mouth. So ma'am kanang ang imuhang other finger or like ang thumb, pwede siya ang thumb or kung maglisod ka, ang imuhan nilang kani, ang 4 fingers. So pag break mo sa latch, then imo something sulod sa baby's mouth, then work i-break nimo sa iha bitaw sa sulod sa corner sa mouth, and after that kuha na dayon nimo imong hands. Sige daw ma'am, hala kung sa sulod daw and then kuha dayon nimo. Sige. Thank you ma'am. So by that, it ensures that the baby have a proper breastfeeding and also to have this action will break this action between the child's mouth and to the breast. So it ensures that the baby will have a proper breastfeeding. For the another one, we also have to the other latch. So push finger, same word hapon sa kanina ma'am. So pag push nimo sa fingers ilalom and then break na pod ka. Oo, sige. So pag push a finger, then break na pod ka. Sige. Oo. So assuming that the baby's mouth is widely open, so it ensures that the pulling the nipple will have the infant's mouth, while latch can cause nipple damage. So that's why latching is very necessary. For the different positions while having breastfeeding, first is the lying part or the laid part position. So have the baby, first you are going to have the mother in a proper position. So like, mamurag something nagigap ka, o ana, and then isbog-isbog ka gamay diri o ana, murag something na slide. And then ang baby is anak po siya sa imuha. So murag, make sure that the baby's mouth, make sure ma'am na ang baby's mouth niya is naa sa imuha nag-attach. So murag something nag-ana siya ma'am sa imuha. Murag something inana. So, like, assuming that the baby's infant is widely open. So, with this position, it is very necessary to have a proper breastfeeding, and also this kind of position will have the positioning from tapping the baby's natural reflexes. So, that is why it is very important since the baby's mouth or he or she, the one who seeks the attention for the breast, instead the breast of the mother will seek attention to the baby. Then, let's proceed to the another position. For the another position, we have the cradle hold position. So for the cradle hold position, it is a very normal position, especially for the common position for the mother while having breastfeeding. So have the mother to stand, so ma'am pwede ka mag-stand. And then after that, like, kanang normal, di ka ni mo ma'am nga, kanang gunitan ni mo ang bata. So ano siya. And then, ma-attach gihapon siya sa inana. Inana na siya ma'am, and then, make sure na kani ma'am nga part is diri abitaw sa ulo gihapon ng anak. Then kani diri inana siya. Always support the skull or the head of the baby to assure that there's no damages while having breastfeeding in this position. So, sit down na ta ma'am. Then let's proceed to the other one. For the cross-cradle position, first, have the mother hold the infant. So, kanang isa ma'am, and then the other part will hold or took the breast in order to have a proper breastfeeding. So, place to the blade part of the breast of the mother. So, inana siya ma'am. Inana na siya ang imuhang position. So, with this, it is very common for the mother, especially during the early weeks. Now, let's have for the football position and also for the double football position. For the football position, it is the most common method or most common positioning for breastfeeding while having breastfeed for the infant. So, this position will allows baby access or have a good source of milk from the mother's breast. For the double football, it is most commonly used for the twins or if the mother has a twins. Now, for the procedure, you are going to have this one. So, ma'am, something is magdiri siya. Then, tangi lang ang imuhang igunit. Then, kuha ni ma'am imuhang breast port. Then, have your infant. So, inana siya. So, make sure that the infant or the baby's mouth is slightly open, and then the mother's areola or whole part of the nipple will be placed on the baby's mouth. So, inana siya. Sige ma'am, for the double football, most commonly siya ma'am kung naay mga kambal bitaw ng anak. So kung kambal, then kanang kuan sila. So kung diri naay diri nagtutoy, ana siya. So sige daw ma'am. Ana, and then diri upon sa other part. So inana na siya ma'am ang sa football position, double football position. For the sideline position, you are going to have the mother, of course, in a side-lying position. So the mother light, and then this one, so inana ta ma'am, then hinay lang, then make sure that the infant will have the easy access sa breast sa mother. So this one is the proper positioning. So inana siya ma'am, then pwede na ta balik ma'am. Now let's go for the koala position. Have the mother side with both feet rather on this straight position, and then place the infant on the mother's other lap. So like that ma'am. So this most common method, especially for the infant ages or 4 to 6 months. So, inana siya ma'am. So this is the koala position. Now let's have for the dangle feeding position. For the dangle feeding position, you are going to have the mother to attach to the baby. So ma'am, like this, sige, inana to ma'am, then i-put diri imong side, and then ikuan sa imong baby. Like inana. So, this is the position for the mother while doing the dangle feeding. So, balik daw ta ma'am. Then, pwede po ba mga mag-sit down ka diri sige daw mag-sit down ka diri dito ka to bang ma'am. Ay, dili. Kanang dito ka to bang mag-ingkod. Sige, ilang ulit mo kang tiil. Anak, sige. And then, mag-anak ka. So, anak. So, this is the dangle feeding position. So, have the mother attach the baby. Since common diseases that can be found during the other breastfeeding is the mastitis. That is why it is also important to have this one of positioning. Okay, thank you ma'am. Now, do aftercare. So, since ma'am tapos naman kita, so pwede na kumusin sa ang baby, and then after that, kanang pwede na tama mag-encoder ma-part since tapos naman. Then after that, the equipment used. So, you are going to be placed on the proper placement since it ensures that the client allays some anxiety and also ensures that the client is safety. So, ma'am, are you okay? So, nakasabot ka mo or nakadumdum ka while nag-assess ko sa unsan proper breastfeeding. Sige, thank you ma'am. So, hindi mo to siya ma-apply, especially kung mga anak nakamanghang. Now, since we're done for the assessment, we have the checking the fundal height, the lipid smell of birth, the pregnancy exercises, and also the breastfeeding. So, arrange for the next prenatal check-up. So, ma'am, next thing mo na balik is mga sunod na po ma'am, mga December or November. So, necessary mga mabalik ka, para po makuanin mo kung na okay na ba, then mag-ask ko itong few questions if na-apply mo itong akong i-teach kanina. So, okay na ma'am? Sige ma'am. You are going to assess for the client's knowledge if what are the knowledge that she gained while performing the said procedure to ensure that the client has the ability in order to apply for the next generation or else for the client while having a birth. So, ma'am, kanang unsay katong imong nadumduman while nag-perform kita ganina ma'am sa exercise na kaya akong nadumduman?
Ang isa ko na exercise para magpanganak sa exercise.
Okay. So, thank you, ma'am. Then, katong sa breastfeeding, nadumduman na mo katong mga positioning niya sa baby, katong sa latching food. Okay. Thank you, ma'am. Then, after that, you are going to assess the client and then provides privacy. So, ma'am, okay ka dira, ma'am? Okay. So, thank you so much, ma'am. And then, I have some guidelines for you for the danger signs of pregnancy and during labor. So, ma'am, if ever, kung na mga signs na makuha ng symptoms, so, it is important to visit the healthcare center. Dili na nimo pasagdaan since it allays the mga complications, especially kanang makuha ng bata or something na something wrong sa imuhang abdomen or sa imuhang fundus. So, mo siya ma'am ha, and then, okay na po ka ma'am, then, balik na lang kasunod po. So, salamat tayo sa imuhang pag-anhi, then, pwede na kang add to ma'am. Sige, sige, add na lang ma'am, thank you kayo. Then, after that, you are going to document the all procedure findings for the conduction of the assessment. Then, after that, you are going to perform hand washing. Importance to the spread of microorganism or to avoid the spread of microorganism. In evaluation, you are going to document the procedure and check for evaluation purposes. So checking is necessary since it ensures for the documentation and also it ensures rather that the client or the record of the client will be evaluated for the next prenatal checkup.